Good afternoon, Doctor.
Good afternoon.
Thank you so much for joining us. I'm Malini Rajagopalan from 1Cell.ai, and it's a pleasure to have you here to interview you and also to attending the Polls conference over here. So first, I'd like to, if you could just share your name and your affiliation, and also a little bit about your journey on how you came to do medicine, and that would be really nice.
All right. Thank you. It's a pleasure here to see you and talk to you.
Thank you.
I started my journey of oncology in 1985. There are no formal degrees or courses, and I applied to Dr. Tattersall in Australia, and they needed funding. And when I went to see my principal that I want to do medical oncology, said, Raman, other than leukemia, what you are going to treat? But I learned with my own efforts, with lot of practice. And then there was a hospital coming up in Ludhiana on the Yoswal Cancer Hospital. And I was appointed as physician, and I learned on my way. I went to Tata Memorial for a short stint, then to Denver, and then to Houston, and then to UK in Cambridge.
It's wonderful
to learn. And most of chemotherapy practices, which I learned, were from the original workers, like Professor Bonatona or Veronis I,
Lovely.
like that.
That's great. So, Dr. Raman Arora, and so now currently, where are you affiliated to?
I'm at the Deep Hospital in Ludhiana.
Ludhiana, wonderful. So my next question to you would be, based on all of your training and experience, is there any specific case that you have about a patient that you can talk about on how you used original methods of detection to be able to treat any patients?
See, originally anything which we do is either by cytology or histology from the tissue. That's how we base our diagnosis on. And then there are radiological tests to stage it, comorbid diseases.
Yeah.
And then we have a plan. In India, economics plays a major role. So we give them a proper treatment schedule. Now, once there are newer methodologies, much like we had a telephonic line, landline, to mobile phones with smartphones. Same is holding true now for molecular level, cellular level, and now subcellular level also, cell biopsy. Now then, mutations, genetic mutation, germline, then further into HRD. So everywhere we are going to take some steps forward. Now, some of them we are going to retract also over a period of time because we don't find them so useful. Like any treatment which comes up in oncology, it comes for metastatic disease, right?
Yeah.
And then it moves to adjuvant and then into neoadjuvant. And we have seen over a period of almost 4 decades that look, whether we are going to stick with it or track back. Then in new technologies also, the rapid approval or accelerated approval of onco drugs, there are certain hiccups also, you know it.
Yes.
Because the way trials are done, these have to be looked at. I am very happy to share with you the current information which is about the diagnostics. Now, will it be like biochemical testing in certain ways, or there are going to be certain definite boundaries about it? Like if we find disease again, like early. Now, whether treating early will be overall leading to survival or not, that's the key point. So we have reached up to that step only, where we can say that, look, we have diagnosed early. Now, taking it to the final step, I believe it is going to be a long way, because survival, sooner you pick up,
the
longer is going to the survival. So the studies are going to be much longer. So saying that we are going to convert into therapeutics is the first step. But saying that therapeutics have worked is another point.
Okay. So that's really, very interesting the way you described it. How do you think that the technological advances that are happening currently would be able to help in what you said? So early detection is one
Is
part,
the first part.
but there's another part. Other part of it, which is a more important part, is how can you treat? How can you not overtreat, mistreat, or undertreat?
Yes.
So how do you visualize technology, one cell or any other technologies and technological advancements changes your treatment approach to your patients?
A valid point in that question. One is treating blindly. After once you have more information, more you add to it. Finer is the technology, better is going to the outcome or the separation. Like if something is happening only to 2% or 5%, I can't choose it policy for all people. Or if it was limited to a particular group within a larger group. And once AI-based things have come, it is going to add up.
Of course.
Definitely.
So you think that technology is going to change the paradigm, so paradigm shift in terms of
Yes,
your treatment.
definitely.
That's
You are small. I always say knowledge is much like that you are on an escalator.
Yeah.
Where you are going to be at the top, or otherwise you are going to have another circle to climb further.
That's very exciting. So thank you so much for your time, Dr. Arora. We really appreciate it. Thank you.
Pleasure.
Pleasure.